Hey everyone, welcome back to the Kural podcast brought to you by the British Tamil Dental Association. I'm your host Abisha and I've been joined by my co-host Charmika. Today we have a very special guest, Dr. Charmika, dentist, mum of two, interests in oral surgery, implants and Invisalign. So Dr. Charmika, could you introduce yourself to the audience for us, please?
Hi guys, I'm Charmika. Thanks for having me here today. So I studied in Czech Republic, so I did 5 years out there. I currently work in Northwest London, so I'm a general dentist, and like you said, I have a special interest in implants. I'm a mum of two, which still sounds so weird to say because I have a 3-year-old who's basically a three-nager and gives me so much attitude and sass. And I have a 5-month son, which is obviously really weird because he's still so small. But yeah, it's been a juggle with two children now. So that's a conversation for another day. And then interest-wise, I am an avid gym goer. So I'm really into my weight training and I just love to read books too. So that's just a bit of me.
Thank you. So to start off today's podcast, we just wanted to ease into it. So could you tell us a bit about your experience studying in the Czech Republic and how that shaped you as a dental professional?
So how obviously I got to Czech Republic was basically I tried here, didn't get in. I had the grades, tried again, didn't get in. So I was just like, I had my backup choice, which was pharmacy, and I was just not passionate about it. So I was like, I'm gonna just do what I'm passionate about, which is what was dentistry. So I looked into other places, and back when I was doing it, not a lot of people went abroad to do dentistry. So it was sort of still like only a few people went. But I was like, it's okay. I'm going to just do it because if this is what I want to do, I want to make it work. So I moved to Czech Republic and honestly, it was really difficult at the beginning because obviously you've moved away from home. You are in a different country. You can't speak the language and definitely you kind of grow up really fast because you're used to being at home with your mom and dad. Mom's cooking for you. You have to do all of this sort of stuff, pay your bills, all of that, which I know you do that here anyway, but with another language and not being able to speak it was a totally different ball game. But generally, I think after I would say the first couple of months, I learned like eased into it, and then you find like a family there because your friends become your family because you don't really see your family as often. You come back for the holidays maybe every twice or three times a year. So yeah, I made really, really good friends there, who I'm really still close to. And yeah, honestly, I don't regret any of it. And I think it was one of the best experiences I did to live abroad. And Prague was great. It was a great city. It's beautiful. It's a great uni town. So a lot of partying and things like that. So work hard, play hard kind of thing. So yeah, I think it made me stronger and more independent, to go abroad essentially, because it pushed me out of my limit.
Mhm. That's really cool. I feel like the Czech Republic is not as popular as a kind of country to go and do dentistry abroad because I've mostly heard about Bulgaria. How did you go about finding Czech?
So I actually, at the time, I knew one girl who had gone to Czech. She went to a different part of Czech. But you're right, that time it wasn't. And I looked into like European universities that are recognized in the UK. You don't have to take an exam or anything. And Charles University was one of them, which is the one I went to. So it's quite a big university in Prague, essentially. But nowadays, everyone's kind of branching out. So Bulgaria, I had friends that kind of didn't like Prague or didn't, pass through. So they had to move. So Bulgaria was one. Valencia is another one. A lot of people went to Madrid. So there's a lot of other places nowadays that people are going to. I have a cousin actually going in, and he's in Valencia at the moment. So yeah, basically, I think it's a lot more common now. In terms of how I found it was that there was an agency at the time. So they basically kind of help you to kind of coordinate with the university. So you do your entrance exam and everything through them and you just pay them a fee and they kind of just sort everything out. So that's how I kind of did it. But I didn't know anyone from the university as such. So it was kind of just me winging it.
It must have been really nerve-wracking during that time.
Yeah, honestly, yeah. And then my parents are also like, what's going on? Like, is this right? We're going to this country you don't even know. But then after that, once I was there, my sister joined like later on because she did medicine there too. And then it was okay because we all knew like how it was and everything.
Was it hard to convince your parents to let you go abroad? Because I feel like South Asian parents can be quite strict in terms of like keeping their children at home.
Yeah, so I was honestly, once I didn't, so obviously you do your A levels. I got my grades and I didn't get any of the unis at all the first year around. And I was ready to go then. Like, I was like, I want to do this. Like, I don't want to waste any time. But my dad was very like, let's just try again. You never know, you might get another, you know. So I waited another year, took a gap year, worked in like co-op just to earn some money. And then I got one interview and it didn't work out. So then my dad was like, okay, fine. Like, you've obviously tried in the UK and it hasn't worked. So yeah, let's do it. But obviously there were a lot of aunties and uncles that would tell him, you know, I don't think it's safe you letting a girl, especially like a, you know, South Asian girl, go to a country that she doesn't know, you know, could be dangerous, things like that. But I think my parents especially are very true believers of that you shouldn't treat a boy and a girl very differently. Because if it was a son, he would have done it without, you know, and he thinks the same. Like, if it's a daughter or a boy, it doesn't matter. So I was quite lucky in that sense that they were quite supportive of me moving. Obviously they're worried, you know, you would be, but yeah, we just Skyped every day, and that was, yeah, we obviously Skype back then, but that's what we did every day, and it was fine, yeah.
So how's your experience been as a dentist, but also a mum of two in the Tamil community?
So I think irrelevant of the Tamil community, I feel like being a mom and a dentist or even just a working parent is hard. And I think that's one of the things that I would say I didn't anticipate when I come out of uni. Because when you're young, all you think about is, you know, studies, coming out, working, that's it. But then when I actually had children, honestly, the juggle is really real. So I work currently part-time, but I'm with my kids the other days. I feel like I'm full-time all the time because when you have a child, it's not just a 9 to 5 job. It's like they wake up at like 7:30, 8 o'clock, and you're going still till like 8:30. So it's a 12-hour day essentially. But I think that's probably one of the hardest things I've had to manage. And I did a post recently about this, that especially because I'm on maternity leave now, I'm feeling a little bit, what's the word, in terms of, I don't feel like as women, it's very hard to progress, especially when you have to take career breaks as women because you're having children. And you don't really realize that it does push you back a little bit. And you are seeing all these other people kind of progressing, getting to where they want to. And you kind of feel like you're left behind. And I know that I kind of have realized that you might not be able to have everything all at once, like be that perfect mother and be that perfect career woman, but it just might take a bit longer. And you would obviously, you know, be with your children now and spend that time with them, and, you know, because they are young only once. And then essentially after that, you would look at progressing your career more and things, but it's definitely a balancing act. And I think I've really struggled with that sort of thought, but I feel guilt from one way and then guilt that I'm not progressing as I should. So it's like a mental battle sometimes.
And you said that you're interested in implants and Invisalign. What initially drew you to this area of dentistry?
So I think more so my passion is implants, and the goal is to move out of general dentistry and into implants only. So when I basically came out of uni, I was working in a practice. So we didn't have, as students abroad, we didn't really have a FD essentially.
Yeah.
So the year that I studied, we applied, none of us got it. So we essentially had to find jobs by ourselves and to find someone who would kind of mentor us and things like that. So it's quite difficult and quite stressful in a sense. So I worked in a practice in Lincoln, which is basically like near Sheffield. And this lovely lady, she gave me an opportunity, and, you know, but she did say, obviously, you need to do like 5,000 UDAs at the time, which, to put it into perspective, an FD would do like less than 2,000. So you are doing a lot more and you have to be quicker and faster. This is you coming straight out of university. You haven't had much experience. But I took it because I was like, I only have this. I'm going to just make it work. So when I was there, I had a mentor, and he was really, really good at oral surgery, and he always would take out teeth super like fast, and he had all these techniques, and I learned a lot of tricks and tips from him. And then I realized from that I actually really like the surgical side of dentistry. So that's what made me think, oh, what can I do with that? And that's when I looked into sort of implants, and I was like, yeah, this is something a bit of me. So I did a course in sort of implants, and basically you do like lectures here, and then you do a residency in Brazil where you're able to place implants there on the patients there. So that was really good. So that's how I sort of started, and that's how kind of my interest started from that. In terms of the Invisalign, I kind of just fell into it. So I had done my implant course just before COVID, and then COVID hit, and then it was really difficult to sort of do any implants because everyone was just kind of doing preventative work, getting people out of pain. So no one was looking at having any implants at that time. Definitely, I am more interested in implants, but Invisalign is a good sort of side that I do. And also, my patients were asking for it. They were like, "Can I have straight teeth? Can I have whitened teeth? Can I have composite bonding?" So it kind of just all went hand in hand.
So you mentioned that you did like a residency in Brazil for implants. How was that? Did you stay there for long? Like, how did it work?
So I did a course, it's called Implant Success, and they do all their lectures and like their theoretical work in England. And then when we went to Brazil, so they have a clinic that they work with the dentist there who has a clinic there. And basically you have like patients, and we did about probably like 10 or 12 implants over there. So it was really good because you're actually placing on real patients. Because a lot of the courses that I found here, you're placing on models, which is just not the same. Like you don't have the same feel for it. And like placing it in a person, feeling that soft tissue and the bone itself, how soft it is, how hard it is. You're not going to get that with like even like pigs or with the models that you do. So that's what I wanted to do something like that because I feel like that's what you need in order to progress. But yeah, definitely the Brazil or like some sort of course where you're placing on actual patients would be the best. So there's other courses like I know one of my colleagues, he does one in Dubai and things like that nowadays. So there's a lot of more courses nowadays to do like abroad and actually placing on patients. So I definitely would recommend. So I was there for about 10 days. And every day, it was really intense. And every day we were sort of placing. So it was really good. And then you obviously get a little holiday out of it too. So honestly, yeah, I would definitely recommend.
Yeah, that seems really cool. That's definitely something that I'll be putting on my list.
So you said that you found a course where you get to place on patients. What advice would you give to people who want to find courses where they'd actually benefit out of them?
So if it isn't into implants, I think doing courses like that is great, right? But the thing is with implants is the more you do, the more practice you have and the more skills you get. And unfortunately, implants is like a numbers game because the more you do, the better you get.
Yeah.
So even though you do like 10 implants, I still feel like you come out and you're not as confident. So you just need to sort of place. So I actually worked in Reading and I met my mentor who was working in a specialist practice close by. And I just happened to sort of go there to kind of see his CT scanner and, like just kind of meet him essentially. And he just was like, "Oh, if you need any help, then let me know." So that's how I kind of like met someone. So I think having a mentor is really important because you need that help to sort of do cases, go through cases, CT scans, because these are things that we don't really learn in university. Like, I don't know about you guys, but I didn't really read many CBCT scans and things like that. So those are the things you have to like pick up on and things like that. Definitely getting a mentor is one, and obviously doing a course just to have like a general sort of foundation for implant dentistry. But I think practically implants is everything. So the more you do and the more you see patients, that's where you're going to gain your experience. So that's what you need to look for.
So you're working as a general dentist now. Do you do implants often, or is it more like a rare
So
thing?
actually, I wasn't doing much when I was like pregnant and things like that because I'm kind of tapering off. But I actually recently joined a company, and basically how they work is it's actually my mentor who's started up the company, and he's basically has practices and he sends you out to different practices and you basically place the implants in those practices. So essentially like you're contracted as an implant dentist, which is great because you go there, you do like 4 implants and then they pay you per implant, and yeah, so you're basically getting your numbers in that sense. So I started that. And then the idea, hopefully, is I want to sort of move into sort of full arch implant dentistry. So like all on 4s, all on 6s, that sort of thing. So I've been sort of shadowing at a full arch clinic. So kind of just, seeing what I need to do and things like that. So hopefully in the future, that's where I'm sort of looking to sort of thing. So yeah, I am placing more now because I'm kind of back at work. But when I was pregnant, I was kind of just not doing too much. Because the thing is with dentistry, you can't just leave your patients. Even though you're on maternity leave, like you still have to go back. Like right now I have implant patients and I have like Invisalign patients that I have to go back once a month just to be like, "Oh yeah, how's everything going?" So Whereas if you're actually in a normal corporate job, you get 6 months off or a year off, essentially. So I didn't want to have too much to go back to, which is why I kind of was like tapering off. But yeah, I do more now for sure.
That's really cool. I don't know you could do like locum as like an implant.
Yeah, so this is like a startup company that my mentor has started like about a year ago, and it's working really well. Like he's got a few practices, and whenever they need someone to think, and it benefits everyone really, because the practice, they don't want to refer out to somewhere else where they lose the patient. This way, it's in house. They get to keep the patient. They still get paid for it, and essentially for me, someone like me, I can do these cases and do more complicated cases if my mentor's there or he's not there, and whichever. But mostly I'm doing them like on my own or things. Yeah, so I think it's a really good idea in terms just to build your skills, really.
And working with implants, are there any tips or advice that you'd give to other dentists who want to work with implants, but they just don't really know how to find their way about it?
So I think always start with a course, but I think just start talking to your patients about it. Like that's the main thing. And I think that's the biggest hurdle as well, like having that patient conversion. Because obviously there's lots of common myths with implants. When you start talking about it, patients are like, oh, it's too painful, or it's not safe, or, they don't look very natural. Those are the kind of myths you get. But it's honestly about patient communication. And I think that's something I didn't learn when I was in uni, because we are communicating in Czech with our patients. We weren't very fluent with it. So I wasn't having those big conversations or telling them the pros and cons and things like that, which I had to learn more so when I came back to the UK, which I kind of struggled with. And like I learned over the years, like telling the patients and giving them the value that this is what you need is what you're going to get to convert your patients. And I think one thing I do now is scanning. So scan your patient's teeth. If you scan and tell them, then you can show them like, this is what you have. You have a gap here. You're probably you're not using your left side because you have a big massive gap, and you're overusing your right side. So your teeth on your right side are going to have more damage and things like that. And so when you can visualize those kind of problems, patients actually understand better, and they're like, oh, actually, yeah, you're right. And it's just about telling the patient that this is of value to you, because most patients have the money for this. It's just whether they think that it's a priority that they want to pay for. That's what you need to kind of convince them of. So it's not like you're doing a sales pitch saying this is what you need, but it's kind of telling them, yeah, this is a benefit to you. And long term, an implant is, upfront cost is expensive, but long term, you're going to get so much more value out of that than having, say, a denture, for example, which you're going to just be replacing every 2 to 3 years because it's loose and so on. It's just about educating the patient and doing that. So I think doing more cases is really what you need to, and you just need to get out there. And I think if you have a mentor, do a course and just start talking to your patients, then that's the way you're going to sort of get into it, I think.
That's really good advice. Thank you.
If you're enjoying this episode right now and you find it really helpful, it would mean the world to us if you could just follow or subscribe wherever you're listening and share it with someone that you think that this would be really, really helpful for. That way we can bring on more and more guests and share more of our stories. Anyway, let's get back to the guest.
What do you find are patients' biggest concerns when it comes to implants? Is it the pain or the cost? Or is there anything else that patients tend to?
So I think cost is a big factor, because everyone right now as well, with the climate and everything being so expensive, everyone is obviously looking at their money. I do think, but patients will think if it's of value, they will accept, right? So cost is one, and you just have to talk about things like finance. They can, finance it over 10 months or interest free. Like that's much more easier to, for them to manage, essentially. So that's one thing you can say. The other thing is obviously that they think it's very painful. You're saying you're putting a screw in my bone. Yeah, that doesn't sound nice, does it? So so that's one thing you need to say to them. And I usually kind of explain it to them as that it's kind of like having an extraction. They would have had extraction because they've got a gap, right? So they know what that feels like. So I was like, it's a little bit of pressure like that, not as bad. And then it's like you having a filling, just a bit of vibration and water. That's what you're feeling, a little bit of that. And usually when you say it that way, they're not so thinking. And then after you've done it, they're like, actually, that wasn't that bad. My extraction was probably worse than having that. So, and most times they just have painkillers after, because it's not even that painful. Like I have patients who come back and say, I only took painkillers for like 2 days after and I was fine. So it's just about educating them and telling them that it's not all these like things you see on social media that, this goes wrong and that goes wrong and things like that. The other things I think people do think is unsafe is that it's like metal in your bone, but you just need to explain that it's titanium. It's very biocompatible with your bone and it actually integrates really well, and it's, very natural essentially that way. I think that's it really. I think cost, obviously, yeah, you need to think. But I think over time, as you keep speaking to patients and if you're confident with it, patients will just see that. And I think patients know when you are confident because they're like, oh, she doesn't know what she's talking about. I'm not going to go for that, essentially. So confidence is everything, I think.
Thank you. That was really useful.
So you said that your patients come in saying they saw X, Y, and Z on social media.
Mm.
How has that presented to you as a challenge and how have you gone about it?
So I would just say like what I would be saying, as I said. So things like, the pain, or they see things on Google and things like that. And sometimes they see those horror stories that you get from like Turkey, like, that they've had to remove all their teeth and things like that. So you just kind of have to say, like, obviously don't believe everything you see on the internet, because that's why you have the professionals to talk about that with. And like people, even like us, like sometimes we go on Google, we look at things and they tell us the worst case scenario and you're like, you have cancer or something because you've got a little lump on your lip, but it's not really that. So as long as you're sort of educating the patient, then it should be okay. But you can't really stop what you see on social media, unfortunately. It's a big part of life now, and just educating is probably the best, yeah.
You said like education and communication plays a big role in your work as a dentist. Obviously, you said you don't learn much about it in dental school. So what have you picked up on during your work as a dentist?
So I think the first 2 years for me was really tricky. I really struggled because obviously you have your FD year, and then even after that, you're still quite new as a dentist in a sense. Because of the communication, one, we weren't talking to patients as much, when I was in Czech. We were partnered up with Czech students, so they obviously spoke most of it to the patients. They were kind of translating. So you kind of just sat back in a sense. So you weren't really talking to the patients. I had to build as I became when I was an FD or even a year after that. So communication was everything. And two, I think writing notes and things like that, I didn't really do. Well, we did, but not as, as contemporaneous as we do now and how much we write. So those are things that I felt like I had to pick up fast because, like I said, my FD practice, she said that initially, obviously, she said you can have half an hour for a checkup. And obviously in dental school, you have like all the time in the world to do a checkup. You have 2.5 hours to do a filling, but you're in NHS dentistry and time is money, right? So she gave me about a month for me to sort of settle in. And then after a month, she said, you need to kind of speed up now because I need to make money. And that's not her fault because she's right. She's a businesswoman. She needs to make money. This is essentially dentist is a business. So I had to learn fast, essentially. And sometimes, you get patients that are not happy because you haven't communicated everything well. But I think over the years, I've learned to speak to patients and give them all the pros and cons, because I think the main reason for complaints and things like that is because you haven't explained everything to them and then they're blindsided when things go wrong. So I think just working and kind of making mistakes, I guess, and then learning from that is what I've sort of done, essentially.
Yeah, your experience must have been really different in Czech with like not being able to communicate with the patients. So the 5 years, did you end up learning Czech?
We have to do a mandatory of 2 years of Czech when we start. So first and second year, we had to do Czech as a subject. We basically just learned to pass the exam. I could probably communicate a little bit in terms like the basic stuff, how to open the mouth, can you lift your tongue, that sort of thing. But I wasn't very good at sort of speaking. I can understand more than I could speak, essentially. So yeah, and then also when you're with a Czech partner, you kind of just step back because you're like, they will explain it better and you didn't have to. So I feel like we were helped a lot. So if I was maybe on my own, I would have maybe, put more effort into it, but I didn't learn as I should have. I learned for an exam and that's how I did it.
Did you learn the course in Czech or was that all done in English?
So the course itself was in English. So everything was English. It was only we had to just learn Czech just so that we can communicate with patients.
Do you think your struggle to actually communicate in Czech, did that create a sort of barrier between you and your patients in dental school?
So I think in dental school, I was I was more concerned about doing the actual procedure rather than actually explaining all of that sort of stuff. So like I was panicking, oh, am I going to do this filling right? Or am I going to do this extraction right? Rather than what the patient was thinking, because essentially our lecturers or our Czech partner would kind of take that over. So I didn't have to think about that communication side. So that's when I came back to the UK, I was like, oh, wow, I have to do all of this now. So that's why I felt like I struggled a little bit. But yeah, definitely, I felt like I kind of got complacent in that side. I don't know how it works in UK here, but do you find that you speak to the patients more? Do your lecturers do it for you?
We have to do all the, is that how it works for you as well? We have to do all the communication ourselves.
And then we just have to like give the tutor like a summary of when they come and check. But they mostly just go straight into like checking the mouth. They don't really speak to the patients as much. Even with like giving like post-operative advice, they kind of just let you do your thing.
Okay, so that's good. Yeah. So I think that's basically what the Czech students were doing. And we just kind of sat back because we couldn't really speak the language, basically. So yeah, that's basically probably a downfall on that part of uni. That's why. So yeah, I think I just had to learn fast when I got back, eventually.
It's impressive how you picked yourself up pretty quick though, because you only had 1 month.
Yeah, honestly, I was so like scared after that because I was like 1 month into it. I was doing half an hour checkups, and then she was like, "Yeah, so can you do half an hour fillings?" And I was like, uh, I could try." So then we started with like 45 minutes. Yeah, but it was hard because we're not used to that kind of speed. I don't know how long you guys have for fillings at the moment.
We have like 2 hours. Like
Yeah, this is what we had at uni. That's what I was used to. Like you put your rubber dam on nicely, make it look really aesthetic. Then you're, doing a bit of drilling, you're showing your teacher, it's all of that. And this is like in, out, you need to. And that's what NHS dentistry is. It's very, it's kind of like patient in, patient out, because that's how you make it. It's a volume that you do is how you make the money essentially, right? So yeah, it was definitely a very steep learning curve.
Yeah, that's so crazy because I feel like sometimes now I spend like 30, 40 minutes just putting the rubber dam on. I can't imagine doing.
Yeah, honestly, yeah. This now you have to literally do your rubber dam in like 5 minutes, and not even just, But obviously with NHS dentistry, you're not always doing rubber dam. Well, actually, yeah, you are with root canals and things like that. So yeah, 5 minutes, yeah, even less. Just put the rubber dam on and have to start because you haven't got time.
Have like a supervisor or someone just watching over you during that first year, or were you just expected to do everything yourself?
No, you are on your own in that surgery, doing it on your own. And if you have any problems, then you can call your mentor. And even that, you are like, he's got his full book, right? So if he's in the middle of a procedure, you're waiting there for 10 minutes, waiting for him to, So some of them, you're just like twiddling your thumb, trying to make small talk with the patients, like, yes, he'll be in a minute. Yeah, it was hard because so I think that's why, because I was just pushed into the deep end, I just had to do it. So I learned a lot faster, but also I feel like it was hard when I was doing it. So I think from those kind of that year, it really made me give like a lot of anxiety in terms of like, this is going to go wrong, that's going to go wrong. And I was catastrophizing everything I was doing, second guessing myself. And I never really had that before. But because I was in such a high stress situation, I was just panicking all the time, thinking this is going to go wrong, that's going to go wrong. So that was, I think, and mentally as well. I think dentistry in general is very draining. Plus, if you're learning a skill on top of that with patients who are expecting you to do 100% all the time, it was tough.
So with the Invisalign treatments, how do you find that? And how do you navigate the appointments? Do you find that patient expectations tend to be a bit different to what you can actually, and like the outcome is?
So I think with Invisalign, especially when you're starting out, I think case selection is everything. So you want to stick to, when you first start, you want to stick to sort of simple cases like class 1 cases, just mild sort of crowding. So that's something that's very predictable, and you know that you would get a good result, because you don't want to be going into something really complicated and then having the patient not be as happy as they were, So I think obviously that would be the best thing to sort of start with. And then with Invisalign, obviously it's cosmetic. There is always going to be high expectations with the patient, but you need to obviously show them like, okay, sometimes we aren't able to get 100% because, say, for example, your gum line isn't symmetrical. So if your gum line isn't symmetrical, then we might have to do some laser or, gum contouring and things like that. So that's another cost that you need to think about. But these are things you should be telling them before they start so that they are aware of these kind of other things that could happen during the treatment. Because Invisalign is just obviously moving the teeth, but there is a lot more to just moving teeth and having a nice smile, essentially. So you've got to look at the symmetry and how the bite is and things like that. And sometimes, you might have a crossbite at the back, and with you might need to see an orthodontist if you want to, see do the crossbite, essentially. So if you don't explain those kind of risks or problems that could occur, that's when I think you can get into trouble. And especially with cosmetic, people have very high standards, especially when they're paying a lot of money. They expect it to be perfect. So as long as you manage those expectations and they understand what they're getting out of it, then I think you'll be okay. So that's why I would say start simple, and that that, yeah, this will get a good result and I know that's going to happen.
So in terms of having those conversations with patients, how do you navigate those conversations where you have to discuss costs, but then also the realistic outcomes of Invisalign treatment?
So I would just give them options. So for example, obviously you have your baseline cost for your Invisalign, and you would tell them that this would move the teeth in this way.
Mm-hmm.
Say if there are other aesthetic concerns, like, for example, they have a crown that doesn't look very nice, or they would like to do some composite bonding after, because, when you straighten the teeth, it doesn't mean that the teeth will look straight if their edges aren't straight. You would need to look at, doing composite bonding. And then if you're doing composite bonding, did you want to do whitening? And so you need to discuss all those options and give them the plan like you would. So is it just that you want to just straighten the teeth and whiten and you're happy with that? This is what you would get. Or is it that you want more of this look? So you need to really listen to what the patient wants, because not every patient is the same. So some patients want that really sort of white, smile, and they want to see that they've had their teeth done. Some want a more natural look, so it's very patient dependent. And I think listening to them first and seeing what their concerns, why have they come and sat in your chair and said, I want to do something about my teeth? What is it that they're unhappy about? That's the first thing I would say, listen to the patient. Because if you don't know what their problem is, and if you don't fix that problem, even if you have a nice smile in the end, you haven't fixed their problem, they're not going to be happy. So that's that's their main concern, is what they want to change from their teeth. So that's, I think, the biggest thing you would need to do. And then cost, with that, you just have to obviously explain the cost and why this is more cost or something like that.
So when we apply for dental school, obviously we hear that the hardest part of the career is the back pain, managing patients, and just the stress. Do you think there's another challenge that is like worse in dentistry that you weren't really aware of before applying?
So I would say, obviously, back pain, that sort of stuff, I think, yeah, that's definitely a thing. But I think to combat that, get yourself some loops, because I think that really does help. The other thing I didn't anticipate was what I was talking about before, is obviously managing being a parent and being like a career woman, essentially. So that was really something I didn't look at. And then the other thing would be, I guess, because my communication wasn't great back in Czech, sort of complaints, litigation, things like that. Not that we have, but unfortunately, our job is that we are working with the public. There will be people that are not happy with what you do, and that's just how it goes. So it's about managing those kind of patients and making sure that it doesn't go any further, or, that's the thing. So I've learned over the years how to manage different personalities. And I think that's something I didn't anticipate as well. So it's really important. I feel like as a dentist, you are like a therapist. You are basically giving advice, and you're trying to, because when that patient comes in, they could have so much stuff going on at home, but they take it out on you, or they're like, oh, they're not happy with this because of that. But usually it's something that they have as a problem, and you need to learn to sort of manage and think, okay, it's not about me. The patient's obviously unhappy. How can I make it better? And that's something that, yeah, I feel like I had to learn the hard way, because, yeah, our job is about just managing, and you're going to have so many people that are different.
When did you get loops?
So actually, I didn't have loops for a couple of years while I was working. Sure. And then I was like, actually, I should get some. And honestly, it was the best decision I ever made, because it's now I can't live without them. It's like I don't have it's like my right hand. Like when loops break or I need to like get them repaired, I'm literally like, what do I do? So definitely I would invest in some good loops. I have the Bryant loops and I've just got like a 3.8 magnification, so nothing too much, but that's because I do like implants. So I don't need it to be very high magnification. But if you are doing more like cosmetic work, endo, things like that, then yeah, like a 5 or even a 7.5 is something that you should look into. But definitely, I don't regret having loops. I regret not having it sooner. Let's just say that.
When would you say is the ideal time? Do you think during dental school or after graduating?
I think with dental school, I don't think, because it's a lot of money and you're not working with patients every single day, I don't think it's absolutely necessary. I mean, if you can, then great. But I think definitely after, when you come out, definitely start using it because it will only help you because you will see a lot more. Just general things like when you're doing a root canal, you can see the canals better. When you're doing a filling, you see all the decay better. It's just honestly invaluable.
And earlier on, you said you saw your mentor doing a bit of oral surgery, and that's what got you into implants, right?
Yeah.
What could you tell us a bit about the case that sparked your interest in implants originally?
I don't think it was a case as such, but he was doing a lot of like surgical extractions. So, separate, what's it called? Dividing teeth and roots and things like that. Even sometimes he'd raise a flap if he needs to. But generally, that sort of working with like the bone and the soft tissues is what really helped. So I wouldn't say it was one case as particular that sort of sparked my interest. And because when you do implants, you're doing all of that. You're raising a flap, you are manipulating the bone, you're doing bone grafting, you're adding to the bone. So that's all basically what I would like to do. So actually implants was a bit of both in the sense that you are giving the patient back their aesthetics or their function, but also you're doing the surgical side of things. So that's why I think I sort of gravitated towards implants. But yeah, I just love the sort of surgical side. I definitely am more that than the cosmetic side of things. I love all the blood and everything.
Did you get to see a lot of that in dental school? Because I know for us, I don't know about KCL, but do you guys get to see a lot of surgical extractions?
So we literally in third year we do it once a month. We just go shadow the like oral surgery department for like for the full day actually, and then in fourth year we do like once every 2 weeks. I think we do extractions for like half a day. So it's not that much to be fair compared to everything else we do. I feel like oral surgery is probably not touched upon that
Yeah.
much.
Yeah, you think that's bad. Honestly, I could count how many extractions I did in the whole of my 5 years on my hands. That's how many I did. And they were mostly mobile teeth. So I didn't have to take teeth out when I came out of uni. And then I was in this NHS practice, high needs. They needed lots and lots of extractions. And I was there like, I can't take this out. Can you call my mentor, please, to my nurse? And literally, it's so annoying because you're trying to take this tooth out, it wouldn't budge. And he'd just come in and go, and you're like, gosh. So basically, because I couldn't do it, I learned from him, and that's why. So yeah, definitely. I think in Czech, we hardly did any. Yeah. So definitely, I would say it's similar. Probably less than you guys.
So moving away from dentistry, how do you integrate fitness with work and being a mum?
Honestly, I ask that question every day because I don't know how I get to the gym. I'm a really good big morning person. So I usually wake up, get it out of the way, and then I'm done. But right now, because I'm like feeding my son and he wakes up all hours of the night and I just can't leave in the morning. So I'm literally, whenever he naps, and because my husband works from home, I'm able to sort of just snip out for an hour and get to the gym. But right now with 2 kids, it's just so hard. But I try to get in like 3 to 4 times a week if I can, because the gym is like my me time. So I need that time essentially. And if I don't, then I just feel really grumpy and just really sluggish and, not good. So yeah, definitely it's hard, but you can make it work, I think.
And what advice would you give to other dental moms out there who are feeling the pressure to not just look after their kids, but also, the one-off patients that they have to take care of?
Yeah, so I think this is something I struggle with every day too, because obviously you want to be that mom, you want to be present, and you don't want to miss those big milestones for your kids, because they're already young ones. But on the other hand of it, your high achieving self wants to be this great, dentist that's working lots and, becoming this hotshot, whatever, cosmetic or implant dentist so it's like so hard to balance. But I think One thing is that you need to be kind to yourself, because we can't do it all. We are just human. And usually you are doing too much anyway as a mom, or even as a parent in general, because you are balancing everything. And what I learned, especially when I think about it, is that you might not have everything now, but you might not have everything at the same time, but basically you will have it, and you will get to it essentially, but it just might take a bit more time. That's all it is, I would say. So give yourself time to progress and give yourself that grace.
So you also mentioned that you love reading. If you have to tell the audience one book that you recommend, what would it be?
So my favorite author, which I've read most of her books, is Frida McFadden, and her The Housemaid, the film is actually coming out. So that's actually one of my favorite books when I first read it, and I was like, this is so good. And that's what actually drew me to her as an author. So definitely that is a good book. The other one is Verity by Colleen Hoover, which is also another movie that's coming out because it's so good. But yeah, I'm just a big thriller girl. Like, I just love a good thriller book, and just like one of those twisted books. Yeah, so definitely.
Yeah, are you excited for the movie release?
Honestly, I don't watch movies. I'm that movie. I'm just so tired. I go to a cinema and I fall asleep. So I just don't go to cinemas because I pay £15 to just go sleep. But this movie, I'm probably going to stay awake for, and I'm actually going to go see. So yeah.
Yeah, I've read that book. It's really good. And it was like
Right?
the first book that got me into thriller as well. And then after that, I read a few more books from her. So I read The Inmate.
Yes. Oh, I'm actually reading that one. Oh no, I read that one. Yep. I'm reading another one called Ward D. So it's like about.
I read that too. That
Is
was
it good?
The plot twist was insane.
Oh my God, I'm like halfway through it, but I haven't read it. But yeah, I need to read that one. That was thing. But The Inmate's that's good too. That was really
Yeah, I
twisted
really
as
like.
well.
I was so shocked because I had
Yeah.
I thought I got the plot twist in the start, but I didn't actually get
It
it.
did sound very predictable, but it really wasn't.
Yeah. Thank you guys for listening, and thank you so much for Dr. Charmika for joining us today and giving us all these tips and advice. We hope you guys enjoy the episode, and we can't wait to see you next time.
Thank you.